I'm Ann Simmons for the Los Angeles Times. Cats are popular pets for many Americans. At least 81 million people own them, according to recent statistics. But a new study by researchers at the Stanley Medical Research Institute and Johns Hopkins University Medical Center raises some serious concerns. Researchers say that a parasite found in cat feces, when released into the environment, such as the air or water, poses a significant public health hazard. The risk is especially found in places where felines like to defecate, such as gardens and even children's sandboxes. Pregnant women may be especially at risk. Joining me to discuss the details of the study and its possible implications is Times science reporter Monte Morin. Welcome, Monte.
Hi.
Tell us first of all, what exactly is this parasite and why are we just hearing about it now?
Well, Toxoplasma gondii, or T. gondii for short, is a very wily, very hardy parasite. It infects a wide array of mammals and birds. It can infect humans, it can infect sea otters, cats, and mice, and farm animals. Now, its favorite host, though, is the cat, because that is the only host in which it can reproduce sexually. And so it reproduces in the cat's gut. And when that happens, the cat ends up shedding millions of the parasites through its feces. And there are a lot of these feces that cats produce each year, about 1.5 million metric tons. And so it's become a great concern now because there are recent studies that link the parasite to behavioral problems in animals and possibly people.
Before you get to the types of implications for humans and for other mammals, does this parasite impact both feral and domestic cats, and how is it spread?
Yes, it does. It affects particularly feral cats. In addition to the 81 million cats that people may have in their homes, there's another 25 to 60 million feral cats out in the wild. Now, the ways that cats commonly become infected with the parasite is by eating animals that have already been infected by the parasite.
And what about humans? What's the risk? What's the danger? People are going to be quite alarmed by this.
There is a risk of it. People can get infected a variety of ways. When the cat feces, which contains the parasite, is introduced to water, people can drink it. If the cat feces becomes dry and powdery, people can inhale it. People can also become infected if they eat contaminated meat, uncooked meat that's been infected by the parasite.
And how concerned should people be? My goodness, I mean, these are our furry friends.
Exactly. They should definitely be concerned if they own a cat that is outdoors part of the time. They should be concerned if they work in a garden. Cats like to poop in the garden, so they should wear gloves to protect themselves. They should be concerned if they have children and sandboxes or for children's play. They should cover the sandboxes when children aren't using them so cats can't use it as an enormous litter box. They should also dispose of their cat litter properly. They shouldn't flush it down the toilet. They shouldn't just jump it out in the yard. They should actually bag it and remove it with the rest of their trash to a proper landfill.
Now, you've given some indications of what people can do to protect themselves. Is there a public campaign at all?
This recent study is calling for a public campaign. It wants to educate people about the risks of Toxoplasma gondii, and they're also calling for a reduction in the population of feral cats. That's controversial. People love their cats. There are people that are very fond of feral cats, and so it's a touchy issue. People who are calling for a reduction in the population say that euthanasia is probably not the way to go, that the preferred method would be spaying and neutering and releasing them, or by sheltering them or adopting them, and also looking for other ways of reducing that wild cat population.
Well, it's a fascinating study, and we'll certainly be keeping up with kind of the impact of it. Thank you very much for your insight, Monte.
Thanks.
For more on this and other stories, please visit latimes.com and the science blog at latimes.com.